Access Mental Health is a systemic change that is driven by people who use mental health services, staff that work in mental health services, and the community of Dorset. We went out and we talked to people about their experiences and about what they needed from mental health services. So what we were told is that people would come into services and they would have to convince people that they were poorly. And then through that process, they would often become more unwell. What we wanted was a situation where if someone says they are in crisis or they're in mental distress, that somebody listens to them at that point, because as someone who experiences mental health issues, you are the expert. Access Mental Health is a selection of a range of services. It's important that people who are in crisis are able to access support that they want on their terms. All the principles for every part of the service are based on the fact that if somebody is in distress, if somebody is in crisis, you will be heard.
Connection is a 24/7 telephone support service provided for the people of Dorset. It's for all ages, and it's to allow anyone to contact us in the event of a mental health crisis, whatever that crisis might be. When you telephone the team, the phone will be answered by an experienced mental health worker who'll be able to help you to define your crisis and also support you to find a solution or guide you and signpost you to other people who'll be able to help you. Currently, the provision in Dorset means that you would have to go through your GP in order to access mental health services. This new service means that you don't have to do that anymore. You can just phone and somebody will guide you to the right support for you.
The retreat offers a non-clinical environment for people to make sense of their experiences and in some ways normalising mental health instead of making it something that's very clinical, very scary, and something that people feel it takes them much longer to get back from. It feels like a safe place, it's warm, it's comfortable, it's a place when you're feeling high levels of distress, you can come and just feel safe, and that's so important.
Any visitor who arrives and it's their first time at the retreat, they'll be greeted at the door by one of our members of staff. They'll be given a tour, they'll be shown around. Some people just want to utilise the space, test it, see how they feel in that kind of environment. Some people don't want to be around other people when they're in distress. They might go to a side room and we'll go and talk to them. And the first thing we're going to ask is kind of what's happening for you today.
Having nursing staff but also having peer specialists who have been through it or have an understanding of what you're going through. And even if you say the same thing over and over and over again, they're still there to sort of help you through it and sort of look after you in a way and support you while it's a difficult time for you.
It's a new way of providing a mental health service. So rather than looking for illness and saying what's wrong with a person, when someone walks into the retreat, we're looking for what their strengths are. So actually you may feel pretty bad right now, but you have something in you that we recognise that means that we can support you to identify your own strengths in your recovery.
I think being able to come to a safe environment where you can speak to someone face to face about some of the issues that you might be facing at a particular time, and it's just more personal, you feel more connected to that person rather than just, on the phone perhaps sometimes. The timing that the retreat is open, so it's open in the evenings, and I find maybe for a lot of people that the evenings is actually a time where people might be struggling the most or feel most lonely.
The Community Front Room is a mental health service for people who feel they may be heading towards a crisis or are in a crisis. It's a drop-in service and people can come from mid-afternoon to late in the evening. There's no referral system. People can just ring the doorbell and they'll get a warm welcome here. Community Front Room helps people by offering them a safe place to be. It offers them a little bit of respite maybe, and there's always somebody to talk to here.
I became quite unwell with my own mental health, and I was very fortunate to come across a place called The Retreat in Bournemouth, a place that really helped me in my time of need. After a lot of soul searching myself and a lot of hard work on my own journey to recovery, I now felt that I was in a better place to help others. People were there for me, and I'm at a point now where I'd like to do the same for other people.
People come here for lots of different reasons. It may be that they have something going on at home,
that is causing them distress at the moment. It may be that there's something going on at work. It may be that people haven't accessed some of the regular mental health services, and this is a first step for them.
We welcome people to the front room as soon as the doorbell rings. You know, they're invited in. We'll ask them what's happening for them really. It's not about their illness or their disability or their actual problems. It's just what's going on for them right now. And that is very different to the usual services that we've had before. It's bridging a gap. We're just people that care. We do our best for that particular person at that time. We offer them what they need, not what we think they need. It offers them the opportunity to unlock some of their own skills. We focus on the things that people can really do. I truly believe that people have their own answers, and we just support people to find them.
What we've seen since the retreats opened and as we develop the pathway is that there is really a demand for a different way of working with people. People were presenting at A&E, people were presenting at all sorts of different places, being picked up by police. What we're finding now is that people have somewhere to go, they have somewhere to be, they have somewhere to be listened. We haven't solved the problems yet, of course. We still have plenty of work to do. But what we're really testing out is that this is working. No longer is mental health seen as something that is broken, that needs fixing. More it's seen as a kind of part of the human condition, and as such, it's treated in that way. And we're really excited about the opportunities that it brings moving forward.